Hello, I'm Dr. Dimitrios Stefanidis, Professor of Surgery at the IU School of Medicine and Vice Chair of Education for the Department of Surgery. I am also Chief of Minimally Invasive and Bariatric Surgery for IU Health. The Department of Surgery has developed a mental skills curriculum to enhance performance, confidence, and satisfaction among future and seasoned surgeons. Ultimately, we want to help you optimize your performance, control stress, and improve long-term wellness. As you know, surgeons perform complex tasks that require concentration, cognitive decision-making, and fine motor skills, with minimal margin of error and in high-pressure situations. Our performance on any day may significantly impact the outcome of our patients. These complex demands and the importance of the outcome can create stress, which can ultimately have a negative impact on performance and increased chances of surgical errors. Previous research demonstrates that stress impairs a surgeon's fine motor coordination and dexterity, reduces memory, and impairs attention and decision-making. Moreover, a surgeon experiencing stress is less likely to communicate effectively with the surgical team. Stress impacts surgeons at all levels of experience, but novice surgeons are particularly susceptible to the damaging effects of stress on performance. I personally have been in situations of extreme stress and felt its negative effects. It is hard to think straight, let alone act, at times when patients need your thoughtful actions the most. By chance, I figured out I need to calm myself, take deep breaths to relax, and refocus my attention to the important actions for the patient. I adapted these mental exercises through the years and have benefited from applying them immensely. One such example I will share is when I encounter a stressful situation in the operating room, such as a complication. I tend to get overwhelmed by negative thoughts and self-talk. To redirect my thoughts, I briefly stop what I'm doing, take a step back from the OR table, and close my eyes. I take a few deep breaths and redirect my attention on how best to address the situation and reframe negative thoughts to be more productive. Then, I can concentrate and get back to what is important, taking care of the patient. As a surgeon and as surgical educator, I see the value for surgeons having a dedicated curriculum that teaches them these techniques from the start of their training. Mental skills training is very effective in other fields, including the military and elite athletic programs, and is a great fit for surgery as well. This was the impetus that prompted the development of this curriculum that I hope you will enjoy and, most importantly, obtain the needed skills that will accompany you during your career and benefit your patients. To effectively teach these skills, we have a dedicated mental skills coach. Let me introduce you to Anton.
Thanks, Dr. Stefanidis. I've been working on mental skills training with surgical learners for 8 years. I'll share some strategies that have worked well for us that could also work well for you. Our mental skills curriculum can help you optimize your performance in several ways. You will learn how to set goals, use mental imagery, and manage attention, among other skills. Similar to adding instruments to your surgical tray, adding these skills to your mental toolbox will help you remain adaptable in any situation you encounter in the OR. Whether it's a case a trainee is not performed, or a case that's performed infrequently by faculty, acquired mental skills can help surgeons identify clear targets for attention during surgery, enable surgeons to remain attentive and avoid distractions, and empower them to refocus effectively in the event they experience a loss of attention. Mental skills are beneficial for mindful and goal-driven practice. Like anything, intentional, focused practice makes for excellent performance. Action plans and using mental imagery enable surgeons to practice the steps of a case in their mind ahead of the procedure, which can build confidence and ensure the surgeon is prepared to handle any situation.
Thanks, Nick. While our curriculum is designed to optimize general performance, there are dedicated skills to help surgeons manage two components of stress: the physiological response of increased adrenaline and the psychological response of worry and negative thinking.
Right. Our curriculum features centering with rapid relaxation, which can immediately help surgeons shift attention away from the stressor and reduce the physiological effects of increased adrenaline. And cognitive reframing, which can help surgeons reframe negative and maladaptive thoughts to productive and task-oriented thoughts.
I'm glad you mentioned those. The goal of adapting these skills is not to eliminate stress entirely, as some stress can be beneficial to your performance. Rather, these skills can help surgeons remain in their ideal performance state for surgery, where they're optimally engaged and their performance doesn't suffer. Thanks for your input today, Nick. While we have yet to study the effect of our curriculum on surgeons' long-term well-being, our intuition is that enabling surgeons to optimize performance and reduce acute stress will help them enjoy surgical performance and find it more satisfying. You may find the mental skills acquired here may also help reduce stress in other areas of your life. We hope you find our mental skills curriculum helpful and worthwhile in shaping how you perform surgery throughout your career.